Lass, the manager of Pediatric Education Resources at the Crohn's and Colitis Foundation. Earlier this week, it was announced that the Pfizer-BioNTech COVID-19 vaccine has been authorized for children ages 5 to 11. As we continue to see vaccines being granted FDA approval, parents and caregivers of pediatric IBD patients may have a lot of questions about what this means for them and their children. Tonight, we will aim to answer common questions from the IBD community about COVID-19, vaccines, and guidance for pediatric patients with Crohn's disease and ulcerative colitis. I want to welcome tonight's presenter, Dr. Michael Kappelman, pediatric gastroenterologist and professor in the Department of Pediatrics at the University of North Carolina at Chapel Hill School of Medicine. Thank you for joining tonight, Dr. Kappelman.
Thank you so much for having me, and certainly it's been a exciting week with good news for many of our parents.
Great. Before we get started, let's go over a few quick pieces of housekeeping. The information provided during tonight's chat is meant for educational purposes only. It should not replace any advice you receive from your gastroenterologist, primary care provider, nutritionist, or surgeon. If you have any questions about your specific care, please reach out to your healthcare provider. If you have any questions about IBD unrelated to COVID-19, we won't be able to get to them tonight. To get your question answered, you can contact our IBD Help Center by calling 1-888-MY-GUT-PAIN or emailing info@crohnscolitisfoundation.org. With that out of the way, let's get started. So, Dr. Kappelman, are COVID-19 vaccines safe and effective for children with IBD? And are there any side effects that have been observed with this population? And as well, any concerns with myocarditis in children?
All really good questions. We don't know the answers for sure, as the clinical trial that led to the recent approval in children 5 to 11 did not include patients with IBD. But I think the answer is probably yes. Vaccines are both effective and safe in this population. And here's how I think about the question. First, our COVID-19 vaccines, and specifically the Pfizer-BioNTech, safe and effective for children in general? And the answer is a resounding yes. Are vaccines safe and effective in adults with IBD? Yes, though maybe slightly less so than in the general population, and perhaps we'll touch more on that later. And so finally, if safe and effective for kids in general and safe and effective for adults with IBD, then it's probably safe and effective in kids with IBD, and very likely that the benefits outweigh the risks. Now, you all are joining into this webinar because you probably want details and facts more than just opinions. And so here's what we do know. We know that the Pfizer vaccine was recently approved for use in children 5 to 11, and previously was approved for children 12 and up in the spring. The most recent approval in younger children was based on a randomized controlled trial of over 2,000 children. And in this study, 3 sets of endpoints were evaluated. The immune response itself, efficacy in preventing COVID-19 infection, and of course, safety. And so let's first consider the immune response, or how effectively does the body respond to vaccination and build defense mechanisms to prevent against infection. And from the study data itself, it was clear that antibody production against the spike protein of the COVID-19 virus and several other measures of immune response were similar in younger children, as has previously been observed in both older children and adults. And so that really is great news. The study, of course, also looked at prevention against COVID-19 and found that a far smaller proportion of children who received the active shot developed COVID as compared to those who received placebo. And based on a lot of the statistical calculations that the investigators did, estimated that the vaccine was about 90% effective in this population of younger children. Again, on par with what we've seen in older children and, for that matter, adults. And finally, the study looked at safety. And really, aside from pain at the injection site, which we really see with all immunizations, most of the young child participants had no side effects at all. Some of the side effects reported were similar to that observed in older children and adults, and included the usual fatigue, headaches, myalgia or muscle aches, and very rarely fever. And all side effects were slightly more common after the second dose compared to the first. And I think the last question that you asked about is this issue of myocarditis, which fortunately in young adults is very rare. So myocarditis is inflammation in the heart muscles. It does appear to disproportionately affect teenagers and young adults, and predominantly males. When it happens, although it can be serious, generally speaking, the myocarditis itself is self-limited. It gets better without any specific treatment and without any long-term sequelae. Fortunately, in the most recent trial in patients 5 to 11, there were no episodes of myocarditis that were observed. That said, I mentioned earlier, this is a very rare side effect, and the trial itself studied 2,000 participants, so a large number of kids, but the study may not have been large enough to really detect or assess the frequency of rare outcomes. So I would guess that just like in older children, myocarditis will happen in younger children, but likely it will be very uncommon and usually self-limited without long-term sequelae.
Thank you. That breakdown was very helpful. Taking it one step further, for patients who are on certain medications, are there any vaccine efficacy considerations? We do receive some questions about patients who are not on biologics, and specifically 6-MP. Is there anything that patients and caregivers need to know when it comes to medications?
Yeah, so to be honest, not really. But I will also give you the details there as well. We know from studies of adult patients that immune responses and vaccine efficacy may be somewhat attenuated, and particularly in patients who are treated with corticosteroids or combinations of other immunosuppressive agents. However, that's not a reason not to vaccinate, and pardon the double negative, but on the contrary, I feel really strongly that it's actually these patients who may benefit the most from vaccination. And while probably beneficial, I wouldn't consider highly immunosuppressed patients fully immunized even after receiving the 2 vaccine doses, but rather would consider them mostly immunized and still maintain reasonable precautions, masking, physical distancing to the greatest extent possible.
Yeah, that's definitely good to know. And considering now that children are eligible ages 5 to 11, how is the dosing and vaccine regimen different for children as compared to adults?
Yeah, another really good question. So at least for the Pfizer vaccine, which again is the vaccine that is approved in this 5 to 11 age group, when we think about the adult dose, it's 30 micrograms per shot. And as a matter of fact, that's the same dose that is authorized for use in children 12 and up. For the younger children, the investigators first did a dose finding study and compared a 10 milligram, 20 milligram, and 30 milligram dose, and didn't find much of a difference between the doses. And so in this larger 2,000 person study that led to the FDA and CDC authorization, the dose that was tried, and therefore the dose that was approved, is the 10 microgram dose. So it's 1/3 of the full adult dose. And yet, despite being 1/3 of the full adult dose, the immune responses and effectiveness were quite strong.
That's great. And can you discuss what the Prevent COVID study is and if there are any recent updates to what we've learned? And I know you have some slides that you wanted to share.
Yeah, absolutely happy to. And if you wanted to move to the slide viewer, perfect. So Prevent COVID stands for the Partnership to Report the Effectiveness of Vaccination in Populations Excluded from the Initial Trials of COVID. This is a study focused on children and adults with inflammatory bowel disease that was generously funded by the Helmsley Charitable Trust. Next slide. And this is a neat study in that it's a direct-to-patient study that is conducted primarily over the internet. As of this morning, the study has been opened up to patients ages 7+ who have received 1 or more doses of a COVID-19 immunization. And we hope to open to 5- and 6-year-olds any day now. This has been a wonderful collaborative effort that we've shared with the Crohn's and Colitis Foundation. Next slide. And I'd love to share a little bit more about the procedures for the study and then what we've learned so far. And so participants will do study surveys at baseline, monthly for 2 months, and then quarterly thereafter for up to 2 years, but a minimum of 1 year. For the younger children, the parents of patients will do surveys on behalf of the child. And surveys collect basic information about the specifics of the vaccines that were administered, side effects, the use of IBD medications, clinical symptoms of IBD itself, and of course, the development of COVID-19. And we also offer a optional and free antibody test 3 months after vaccination, and then following the use of a additional or booster dose and at the end of the study. And we are able to reimburse participants for completing surveys or going to the lab to provide blood for antibody testing. The maximum reimbursement for each participant is $155. And we do offer that optional blood testing at any LabCorp location nationwide. Next slide. And just to share what we've learned so far, so we've enrolled almost 3,400 adult participants from every state in the United States except North Dakota. And so I'm hoping that someone who is on this webinar may be from North Dakota and may be interested in enrolling in the Prevent COVID study. We've enrolled 138 participants aged 12 through 17. And like I mentioned, we just opened up to enrolling younger children today. We really are looking for more pediatric participants. Next slide. These figures here show a histograph or a distribution of enrollment by age. And so if you look to the left of that slide, that's our pediatric population. And again, we really are looking for greater numbers of pediatric participants. To the right of the slide shows the breakdown of the types of vaccine our participants have received. The majority have received Pfizer, about 1/3 have received Moderna, and a sprinkling of the J&J vaccine as well. Next slide. And so we've learned a ton in just a couple months, and I'll take you through some of the highlights. And so the initial report described 317 adult participants who were fully immunized against COVID-19. And the really good news is that over 95% of adult participants mounted a detectable antibody response or a measurable immune response after the second dose of either the Pfizer or Moderna mRNA vaccines. This proportion was slightly lower amongst patients treated with corticosteroids and combined levels of immunosuppression, which certainly is in line with some of the findings in organ transplant recipients and other immunosuppressed populations, and helped to in part inform the CDC's recommendation for additional or third doses, which we'll talk about later this evening. Next slide. A lot of people are asking about vaccine safety and effectiveness, and I told you in the beginning of the talk that we know that these vaccines are safe in adult patients with IBD, and here's how we know that. Again, over 3,000 participants have given us information about their side effects. The most common side effects are injection site tenderness and fatigue, slightly higher after dose 2 than after dose 1, and really on par with the general non-IBD population. And severe localized or systemic adverse events were very rare, again, on par with the general population. A lot of people ask, well, gee, how might these new vaccines affect my IBD? Is it going to cause flares? We observed a very low rate of IBD flares in the several months following vaccination. Only about 2% of participants reported a flare. And of course, for a unpredictable condition like IBD, perhaps that same 2% would have experienced a flare even without vaccination. So again, I think that growing data supports the safety of vaccines in adult patients with IBD. Next slide. And so Prevent COVID is now enrolling vaccinated patients ages 7 to 17 years, with 5 and 6 coming soon. And a little bit about the process of signing up if you're interested. Next slide. I'm sorry, if you go back to the prior slide, I might have missed something. So all you need to do, you know what, I had my participant bar over the bottom of my slide. So if you're interested in enrolling, go to www.ibdpartners.org/preventcovid. And from there, you'll get the next screen where you can answer a couple of screener questions on behalf of your child. And if the answer is yes, and your child qualifies, again, the major qualifying criteria are having a diagnosis of inflammatory bowel disease, being greater than age 7, living in the United States, and receiving a COVID vaccine within the past 90 days. Next slide. Participants will then go through a process of informed consent and assent, or a plain language description of the study for pediatric participants. Next slide. And after that, it's off to the races. You'll get this message that tells you that you've successfully enrolled. And in your email, you should find your first survey to complete. So I think that's the end of the Prevent COVID slides.
Thank you. That was a very helpful and informative overview of this very important and timely study and how parents can get involved. So that was great. I know previously we had discussed vaccine, the regimen and the dosing, but are there certain scheduling considerations that parents of young IBD patients should be aware of and take into consideration? Should vaccinations be scheduled around treatments or within a certain time frame between treatments?
Yeah, all super good questions. And you know, even still, questions without definitive answers. And so generally, my recommendation is to vaccinate as soon as possible, and really not to hold or time medicines around the vaccine dose. Now, a lot of factors do come into play, including the types of IBD treatments and the combinations of treatments and levels of immune suppression. So, you know, certainly consult with your child's doctor about the possible need for timing. The one thing I will mention is that for patients who, may be getting ready to start a new immunosuppressive medicine, to go on a course of corticosteroids, you may want to play the hurry up offense and get vaccinated immediately. Likely vaccines will work better in the non-immunosuppressed compared to immunosuppressed patients. And so if you think your child may be heading towards immunosuppression, now may be a critical time to get that vaccine in as soon as possible so that your child can have the maximum response.
Good to know. And what about having other vaccinations at the same time? Is there any guidance around that?
So it is okay to have a flu vaccine as well as a COVID vaccine at the same time. And that has been studied, albeit in adult patients, and really no issues there, and no more side effects, really not even more injection site reaction. And so, it may be one of those killing two birds with one stone situations. Particularly now as we are heading right into flu season, make sure that patients are vaccinated for both influenza as well as COVID-19. In terms of the other sort of standard general pediatric immunizations, we really don't have any data on that. I would say that if the standard peds vaccinations are not sort of time sensitive, maybe do those at a separate time. But for sure, the influenza vaccine is time sensitive. We are heading into the flu season, so go ahead and get them both.
And then staying on this topic of shots and vaccinations, can you discuss what a booster is, what a third dose is, and what IBD patients need to consider?
Yeah, so really good questions and confusing terminology. And so the additional dose, or otherwise known as a third dose, has been approved for certain individuals ages 12 and up who are at risk for not responding as well to that standard 2-dose series. And so again, it's patients who are immunosuppressed, usually patients with higher levels of immunosuppression, selected other patients as well, who can get a third dose of vaccine 28 days after completion of the 2-part vaccination series. Now, booster doses are sort of a variation on the theme, but a little bit distinct from that. Booster doses are approved for adult patients to be given 6 months after completion of the initial vaccine series. And that's largely because the response to COVID vaccinations seems to wane over time. And with decreasing immunity over time, it makes sense at some point to give a booster dose or re-stimulate the immune response to develop those protective mechanisms. And currently, booster doses are approved in patients 65 years and older, or adult patients age 18 and up who live and work in high-risk settings or have certain high-risk conditions or use immunosuppressive medicines. Now, booster doses are, while additional or third doses can be considered in children age 12 and up, booster doses are only approved for adult patients. But that said, it's really only been about 6 months since the vaccines themselves were approved for children age 12 and up. And so I would imagine that certain considerations for booster doses for the children that were vaccinated in the spring will probably be forthcoming, and likely will be reserved for populations that are of particularly high risk.
Great. And can you talk to us a little bit about breakthrough cases among those who are vaccinated? What does that mean? And are vaccines still effective in these cases? Are IBD patients still protected?
Yeah, so breakthrough cases refer to cases of COVID-19 that occur in fully immunized patients. And here's what we know so far. Um, Vaccinated patients are far less likely to develop COVID than non-vaccinated patients. In other words, breakthrough cases are much less common than sort of regular cases in the unvaccinated population. Furthermore, when breakthrough cases occur amongst the fully immunized, they're generally more mild, generally less likely to require hospitalization. And if they do result in hospitalization, are less likely to be on that ultra severe end of the spectrum that requires care in an intensive care environment or a ventilator support or anything like that. We also are, just beginning to learn about some of the risk factors for breakthrough cases. A longer time from the completion of that initial series is associated with breakthrough cases. And so that's one of the reasons that the FDA and CDC approved the booster vaccines 6 to 8-ish months after that initial series. So as the typical immune response wanes, then it's time to boost and re-stimulate the immune system. We also know that the receipt of the Pfizer vaccine compared to the Moderna vaccine is associated with having a higher chance of getting a breakthrough case. And that's largely a dose effect. I mentioned that the dose in the Pfizer vaccine for adults is about 30 micrograms. The dose for the Moderna is a little bit higher, and so it's no surprise that responses decline over time, and it may be more important to boost the Pfizer vaccine recipients a little bit earlier in the course. And I think the other risk factor that we're just beginning to understand in terms of breakthrough cases is that immunocompromised patients are a bit more susceptible to breakthrough than patients with a fully functioning immune system. And by immunocompromised, that usually refers to patients on high levels of immune suppression, like patients who are receiving immunosuppression following a transplant and to prevent rejection of that transplanted organ, or for patients with a inborn error in the immune system and in those pathways. But it may well be that that IBD patients, especially those on immunosuppressive medicines, are at a bit of a higher risk for breakthrough infections. Hence the possibility upfront for a third dose, as well as for adults, that possibility or authorization for a booster shot after 6 months. So yes, IBD patients are still protected, but nothing is 100%. There are definitely vaccination strategies to mitigate those risks. And of course, use the appropriate precautions, wearing a mask, physical distancing, washing the hands, all the usual stuff.
Great. I know we covered a lot of different information and a lot of helpful information for our patients tonight. Is there anything else that IBD patients and caregivers and parents should know at this time?
To borrow the slogan from Nike, just do it. We presented a lot of information on this call, a lot of numbers, a lot of ways to sort of balance or discuss benefits and risks. But I think one thing is clear. In general pediatric patients, the benefits far outweigh the risks. In adult patients with IBD, the benefits far outweigh the risks, and we have no reason to think that children with IBD are any different. And so, all of the evidence, all of the clinical experience we have with other immunizations would say, just go ahead and do it as soon as possible. And any complication or infection that we can prevent, let's do it. An ounce of prevention is worth a pound of cure.
A great note to end on. And with that, I just want to say thank you so much, Dr. Kappelman, for the great information you presented this evening. And we hope this answers some of your top questions that many parents and caregivers may have about the COVID-19 vaccine. If you have any questions about COVID-19 that were not answered tonight, please visit the foundation website at crohnscolitisfoundation.org and see the top of the website for our COVID-19 resources. You can also contact our IBD Help Center by calling 1-888-MY-GUT-PAIN or emailing info@crohnscolitisfoundation.org. If you enjoyed this session and learned valuable information, we do hope that you will share this recording, which will be available on our Facebook page and our YouTube channel with all of those you know who are either battling IBD or are a loved one of someone with IBD. We want to continue to serve the IBD community with programs like this and other critical education and support programs that our patients need now more than ever. Thank you so much again, Dr. Kappelman, and take care.